Well, hi, thank you so much for joining me today. I'd like to start off by just asking you to please introduce yourself and tell us a little bit about your personal and your educational background.
Yeah, sure. Thanks so much for having me. I'm really excited to share about my research today. My name is Dr. Bryce Hruska. I am an associate professor of public health in Falk College here at Syracuse University. And in terms of my background, my education is in the area of health psychology. However, a lot of my research takes a public health lens, which is why I fit well within a public health setting. I can't recall what else you asked me to speak about as far as
Anything
background.
personal you'd like to share about yourself? If not, that's okay.
I don't think I have anything.
Okay.
Yeah.
So why don't you tell us a little bit more about the type of research that you do?
The research that I do falls into two broad areas. So if you think about it from maybe a population perspective, I have research that I've done primarily with people who are interacting with the healthcare system. So they're patients of some kind, seeking healthcare. And I also look at individuals who deliver healthcare. Primarily, I've looked at emergency medical service workers. And a lot of my research focuses on mental health outcomes and trying to understand factors that influence mental health across time, particularly when people have experienced some kind of really stressful or traumatic event. So, in the context of my patient population work, a lot of that work has revolved around working with people who have experienced some type of injury. So maybe they were in a car accident or they experienced some type of assault and it required them to go to the emergency department. So we have done some research with people in that setting, trying to understand how people adjust to those types of events and how their mental health is impacted across time, and the things that predict how someone's going to do across time. And on the healthcare provider side of things, as I mentioned, I spend a lot of time working with emergency medical service workers, ambulance service providers. So these are people who are responsible for offering initial care to people who have experienced some kind of medical event. And they also are primarily responsible here in Syracuse for transporting people to the emergency department. It could be a very stressful job for a variety of reasons, including that you are working with people who have experienced something potentially life-changing,
Mhm.
and you are doing that repeatedly across the day, across weeks. And so it can take a toll on mental health. So we've done some work trying to understand what are the different occupational features that make the job really stressful. And we've done some work trying to understand how we can use that information to develop interventions to help foster resilience in the face of these different events.
Is some of that research around compassion fatigue by any chance?
I haven't looked at compassion fatigue specifically, but I've worked with some closely related concepts or ideas. So we're doing some work with moral injury, which we haven't analyzed yet. We collected the data, but we haven't analyzed it yet. But we're doing some work with moral injury, and most of the mental health outcomes I look at are things like PTSD, which is sometimes really related to compassion fatigue, although
Mhm.
they're separate, and anxiety and depression.
Yeah, I
Yeah,
can see how that could be some outcomes associated with that line of work.
yeah,
So what got you interested in these research topics?
yeah. So I would say that I've always been really interested in trying to understand how people react to stressful events because it's something we all experience. We all experience challenges. It's a normal part of the human condition, but there are varied responses that people have when something challenging occurs. And I've been interested in trying to understand how why some people respond in a really advantageous way. Maybe they even experience a benefit from some kind of stressful
Mhm.
event, while other people may um, really have a hard time adjusting. So I've always been interested in trying to understand, just from a descriptive standpoint, what contributes to these different trajectories. And then on the flip side, if we have an understanding of why some people do well, maybe even benefit, and other people have a harder time, can we use that information to try to develop resources so that people can um, better adjust to stressful events when they occur?
Yeah, so what are some of the major, I mean, good takeaways that you've have learned from that if you're talking to someone about things that either, like why are there differences or what are some things that people could use? What would you
Yeah, it's a great question. In terms of stressful events, we often think about factors that operate before a stressful event occurs, as it's occurring, and then afterwards, after it occurs. And so we know that there are a number of pre-existing characteristics that may make it more difficult for somebody to adjust to a stressful event. So in the area of PTSD, post-traumatic stress disorder, if somebody has a prior trauma history, they've experienced a similar event, or maybe even an event that's not similar, but it was something that caused them difficulty, they're at an increased risk for having trouble adjusting to this new event. At the time that a stressor occurs, your interpretation of the stressor, if you felt it was very threatening, if you feel like you were in danger or that others around you were in danger, that can be a strong predictor of kind of a tough adjustment to a stressful event. And then perhaps, area that I focused on a lot are what are the things that happen afterwards, because those are the areas that are easiest to intervene on, as people are trying to make sense of an event and trying to carry on with their lives. What can we do?
mm,
So some things that we've examined are how can we modify or can we help people change the way they're thinking about a stressful event? So a really common way that we think about stress is as something that can be very debilitating, something negative. We want nothing to do with it. It's not going to do anything to help us. But there's some research suggesting that if we look for opportunities for growth or derive meaning from that stressful event, and meaning can take a variety of forms. It could be maybe I can learn something from this event. Maybe you can find some connection to spiritual or religious beliefs that you have. Maybe you can find a way that it helps you relate to other people or help other people. All these different ways of finding meaning and kind of changing the way you're interpreting the event and help promote beneficial mental health outcomes after you've experienced some type of stressful event. So that's actually the work that we've done with the EMS providers. And I don't have data I can share yet, but we did an intervention. We were trying to help people change the way they were thinking about these occupational stressors that they were encountering, in the hopes that we can improve resiliency and help reduce, negative mental health outcomes.
Yeah, that's really fascinating. And I really enjoyed the brief that you wrote for the Learner Center on the impacts that a neighborhood can have on resilience and mental health following some type of traumatic event, and that the racial disparities that existed within that. Do you mind just quickly giving our viewers an overview of what that research showed?
Sure. So another area of my research that I haven't mentioned is all these different factors I've described are we might call them like person level characteristics. They're features that a person may have, whether it's a characteristic they have or a way of thinking about the world or events that happen to them. Those are all person level events, but we know that the environment is a very powerful and sometimes overlooked contributor to human behavior and how we are behaving and how we are reacting to things. And so some of my research is also kind of zoomed out and thought about what's the broader neighborhood context in which these different types of traumatic events could occur. And in the research brief that I did for the Learner Center, we were working with the patient population and we were trying to understand how neighborhood level factors can impact how someone adjusts after they've experienced some kind of traumatic event. And in that study, we were looking at a few different neighborhood level characteristics. So we were looking at kind of neighborhood level socioeconomic status. We were looking at segregation. So if it was a neighborhood polarized in terms of the different racial identities that people had in those different neighborhoods. And then we also looked at a combination of it's called racialized or economic, racialized economic segregation, something along those lines. But the idea is like if we know that people of color oftentimes have difficulty after they experience a negative event, like an injury in this case. So we're talking about a car accident or an assault. But that's often really confounded with economic status. So if somebody if you have someone who self-identifies as Black and they also live in a neighborhood that's really under-resourced, that can be a really um, can pose a very tough situation for a person to adjust in the wake of some kind of traumatic event. So those are the three things we looked at. So segregation at the neighborhood level, economic status at the neighborhood level, and then this combination of segregation and economic factors. So in that last one, we were looking at, if you are a white person and you're more affluent versus if you are a person of color and maybe you live in a neighborhood that's not as was wealthy, how does that impact how you adjust to some kind of injury? And what we found was all three were important for understanding how someone's going to recover in the wake of an injury. So if you lived in a neighborhood where there's more segregation, or if you lived in a neighborhood where there was more poverty, and if you lived in a neighborhood where it was a combination of those things, so it was highly segregated, and it also was there was a big discrepancy between the poor and the rich, so more affluent and less affluent. Those broader contextual factors could shape how a person fared after they experienced some kind of negative event, a car accident, some kind of assault, anything along those lines.
Wow, that's really interesting. It sounds like you're just doing really important work in this field, and so I'm glad that we have you as an affiliate of the Learner Center, so you can keep contributing and we can keep disseminating your research. So to just conclude, a fun question: do you have like a favorite book, podcast, or movie that you've seen recently, or would like to recommend for other people that may be looking for something new to dive into?
Let's see. I have not caught too much up on TV, and I feel like I'm late to the game on this one. But my wife had mentioned that The Bear is very good, and we watched the first two seasons, and it's a really good show. I think it was on FX, and
Yeah,
it's a
talk
story
about
about.
stress.
I know totally, yeah. There are some episodes where it's like I feel like I have to go and just do some deep breathing afterwards. But a great show about a family and trying to reconcile the past while also creating a new restaurant. So
Yeah. Well,
interesting
thank you
show.
so much. I really appreciate your time, and I hope you are able to enjoy and relax a little bit this summer.
Thanks. Same to you as well.
All
Thanks
right.
for taking the time to talk to me about my research. Appreciate
Thank
it.
you so much.
All right.